I'm really fascinated by parathyroid disease. The parathyroid gland was the very last gland to be even discovered. It's just four tiny glands. It's the only gland or organ in the body where there's four of them. There's two tiny glands either side of your neck. And despite being so tiny, they have a very important role. They manage and monitor the calcium level in your body and keep it very tightly controlled between about 9 and 10. If it gets outside of that range, you can have some problems. There's really only one problem that develops in parathyroid glands. They can get overactive, usually one of the four. When one gets overactive, then the calcium level gets too high and it can create all sorts of symptoms and problems for a patient. Your energy level can be depleted. You just feel worn out during the day. You can be tired. You can have trouble sleeping. You can have problems with concentration or with your memory. It can cause you to develop kidney stones. It can affect your bone health. And all these because of usually just one of these glands being overactive. Now the diagnosis is fairly straightforward. If you're calcium high, you just check a PTH level, and if it's high, that's the diagnosis. We often will see patients the day before surgery, get to know them, do an ultrasound of their neck, and often, probably 75–80% of the time, we can identify which gland is likely to be the problem. We've come a long way from 30 years ago when I was in training, had the opportunity at that time to work with Dr. McGarity, who was the most renowned parathyroid surgeon in the whole Southeast. During those days, the operation was not done as an outpatient. The incisions were about 3 inches long, operations sometimes 2, 3, 4 hours. Things have come a long way since then. Surgery is virtually always done as an outpatient now. The incisions are very small. The operation rarely takes more than an hour, and the patients virtually always have a good outcome, and they're cured of their disease with just a simple operation. One of the main priorities of our website is patient information, and actually we have information on a wide variety of things that we see patients for. So take a look. And particularly if you're planning to come in for consultation, educate yourself before you come, because we really want you to be fully informed about your disease, the disease process, the options, and we want to be sure we make together the very best decision for your treatment.